That's not our space.
Most of the labs here would run or not run controls, we're not sure about. In our system,
Whether they run control or not.
so control is basically to see if the machine is reporting right or not. It's kind of validation of the machine. So in our machines, we run two controls. One which is provided by the manufacturer, and second which is an independent control. So a third party control will be also run. Ensure that the machine is rightly calibrated and it's validated. Then those data of control are sent into a software which we have procured, which maps it to the global standards.
It's the consensus group. Basically, for the last 1 month, any lab that's using this equipment and these same controls, right? So you're actually aiming to be somewhere in between. Now, one thing you need to realize is that the more tests you do, the closer you are to the consensus group. The spread is minimized. The more you are, you're close, because you're basing the mean on the number of people. Okay, so this is now set up with the consensus group. Most of ours are still within this square. Those that are outside pretty much means that now we need to go to activate. So that's how we always know.
We are bringing the same standards which we are doing across the globe. So same standard of health checks will be done here. As a consultation, we can bring them any specialist consultation they require. We can get them services out here. And from November onwards, we're starting that. We would be bringing options of getting a consultation done from all our hospitals across the globe. So we are rolling it out in phased manner from one center to another center, but to start off with in November, we are starting that. I found the human capital here to be very rich. It is just the trust that we need to bring in. And yes, there is a cost factor, but it is more to do with trust. So once the doctors, what they're saying here is what the same would be said by the globally, the trust will be back, and it won't happen overnight. But from a procedure perspective, we won't be able to do that in our centers. But we know good doctors available here. We'll be first offering them, you can go and get it done at one of the large hospitals in Kenya or in Nairobi. If they don't, we can help them facilitate travel at other centers too. But the idea would be try to keep it here. When you have 10 different hospitals available in the vicinity, you would go there. Today, if you look at large hospitals in Nairobi, they are very limited and you can count them on fingers. So the patient does not have many options. Some of them would be limited because of the spending, some of them limited because the hospital is full and they have a waiting list. A lot of factors go into it. So the word trust might be very well interpreted just about medical service. It is about opportunities at the right timing, at the right facility, backed up by the right doctors. So a lot of things has to go together all along. And I think it is just about right now where we are at a explosion phase. This place has good equipment. I can't say PET scan would be required by just cancer patients. Nothing beyond cancer would be using a PET scan. But do they have good OT? Yes. Do they have good emergency services? Yes. Do they have cath labs? Yes. Do they have good surgical units? Yes. Do they have good critical care units? So there's a lot of other things which goes into building a hospital. All that is available, but the quantity which is available is very limited. And where we need to do is investors like Columbia's can come in, put up a few more units, and from there on, you'll see more human capital coming in. A lot of doctors who are practicing abroad, they want to come back. Kenyans who want to practicing abroad, they want to come back. But there are not enough facilities right now. Most of our services will be well within what the Kenya Medical Board has prescribed tariff list, and we are trying to keep it on the lower side of the tariff list. So that's what is the Kenyan Medical and Practice Kenyan Medical Board and Dental Practices tariff list prescribed. We are trying to follow that. Yes, if we can't be offering services free of cost. That's not possible for us. But we'll be trying to bring in what is they see as value for money services. What are we trying to do differently from the others? I think it is about service. We don't want our patients to be waiting for 3 to 4 hours for a consultation. We want them to turn around quick, come in quickly, come and do this, take the services and walk out quickly. If you look at as a company, we go into emerging markets. In population which is requiring healthcare services, quality healthcare services, there is a gap between what is being delivered versus what can be delivered. And we see that gap opportunity here. Why Kenya? I think in Africa, one of the best place for a foreign investor would be definitely Kenya. There's no doubts about that. Both from the policy, government policies, investment policies, this is very nice place for to be in. There is a large population, there's a good human capital, there is enough opportunity to grow in healthcare. We have to start from one place and then start growing. Definitely, I think Kenya is a natural choice in that.